Thank you, Andy, for coming down to Brighton, the 150th anniversary of the Unite CPHVA conference. Obviously, it's a very challenging time with the NHS and for our members working in community health. May I ask what the Labour Party's vision going forward is for the health service, given the challenges posed by the coalition's policies?
Well, we're working on that now, so we want to involve people in building that alternative vision to what the government is doing, the damage the government is doing, because what I think they've done is they've put the NHS on a fast track to fragmentation. And the place I start from in building Labour's alternative is to say, let's now have full integration of health and care services. I think that is what the future demands. But I want people working in the health service to help me build it.
Moving on from that, on a specific issue, because next year public health is going to be moved to local government. May I ask what, and this is obviously of concern to a lot of our members who are health visitors, school nurses, how you see that happening, or what policy you would change should you be, have the ability to do that?
Well, we have to watch that very carefully, and I would not want to see any undermining of the public health profession as it moves towards local government. I'm also worried about the budgets the government is giving to local authorities, because they're randomly allocating these budgets based on historical spend and not giving councils with the greatest needs the most money, and I'm worried about that, so we'll be watching that. But generally, I'm not against the idea of local government taking a bigger role, because though I love the NHS, I think councils sometimes understand prevention more than the health service. They understand the links between good health and housing, the potential of leisure and libraries to improve people's physical and mental health, the links to education and a whole child approach to development. So I'm not necessarily against it, but there do need to be very careful safeguards not to undermine the public health profession.
Is there not a danger that should it go to local government, local councils would do different things? Say, for example, it could lead to fragmentation, because you could have a Conservative controlled council kind of cutting back on public health, while a Labour controlled council fulfills its obligations. How do you view this possible fragmentation?
Absolutely not. You're right to raise that danger, and I'm very aware of it. Councils will get money for public health, and we're already hearing that some have got plans to say, oh yes, well, weekly bin collections are very important for hygiene and people's mental well-being, and we'll grit the roads with that money because that helps prevent accidents. So, what I'm worried about is we'll see this very kind of like self-serving view of public health, i.e. councils using public health money to cross-subsidise other areas of spending and then cut the council tax, and I wouldn't want to see that. So the Labour approach to this would be to set out clearly at national level what all councils have to do to improve the health of the population and ensure that public health remains high profile within the council. So of course there'll be a different Labour approach to this, but as part of our policy review I want the profession to help me build that alternative.
Moving on to Agenda for Change, and I know there was a Commons debate yesterday, there's an onslaught on Agenda for Change by the coalition government led by Jeremy Hunt. How do you see this playing out, and how can the Labour Party kind of combat this fragmentation again? Fragmentation is the key word of kind of paying conditions.
Well, we came together to fight the government's health bill, and that was fantastic. Party, unions, health professionals standing together, and we got close, we didn't manage it, but I want to see the same fight over regional pay, because this is the most divisive move, and actually will speed up the fragmentation of the NHS. What is happening in the NHS at the moment is trusts all over the country are beginning to opt out from Agenda for Change, and the government is doing absolutely nothing about it because it wants trusts to do that. That's its agenda. So yesterday we brought this issue to the floor of the House of Commons, working with trade union colleagues. We lobbied MPs of all parties. The encouraging thing was MPs of all sides stood up and expressed their concerns, particularly MPs in the southwest of England. I would say we've got to build this campaign. It can't stop here. We've got to use yesterday's Commons debate as the starting point, really, rather than seeing it as the end point. And we've really now got to stand up and say national pay is good for the NHS, but it's also good for a one nation Britain. You know, I do not want to see a world where my constituents in the North West get paid less for doing the same job as other people in the south of England.
Okay, thank you very much, Andy.